So please don't take photos of the patients. This is a patient who had melasma. And when someone is having melasma, they focus on the melasma. Every time they look at the mirror, they don't see anything but the pigmentation. And we know that this is a problem. It's not going to go away. Once melasma, always melasma. So if we start to fight pigmentation and fight melasma, we'll fail at the end. So it's very important to let the patient understand, okay, we'll try to control the pigmentation, but let us work on the skin in general, on the health of the skin, restore the structure and the function of the skin while we are trying to decrease the pigmentation, because it's going to come back anyway. And when we do that, by targeting the different layers of the skin, look how the skin is looking much healthier. Yes, the melasma improved. It is going to come back. But at least when she looks at the mirror, we deviated her attention to see the everything and how the skin is becoming younger and healthier. For this patient, I did the 4D, and we did some Q-switch laser for the melasma, very low settings so that we don't exacerbate the melasma. Of course, it comes back, but at least the skin is looking much younger and much healthier. So we need to work on rejuvenation. And this is her forehead, and there was no pigmentation, but the skin, look at the skin. How healthier it is, how tighter it is, how firmer it is. So this is what we need to do by doing the 4D with different layers of the skin targeted so that we are able to improve how the skin is looking. So this is a few months later, and the skin is looking much healthier, much better. The melasma is still under control. We have to deal with the melasma as a medical problem. This is another patient who had melasma, the same issue. Not only melasma, she has so many other issues. But we can see that over the years, we are able to control the melasma. We tell her that it's going to come back, but at the same time, we deviate her attention for rejuvenation instead of just focusing on the pigmentation. Acne scars. If I focus only on the scars, I will fail. But if I work on rejuvenation, then this is what we get after 5 years. After 5 years. Look at her skin. She didn't lose weight. I didn't promise her that I'm going to dissolve the fat, but the skin is looking much younger, much better. The acne scars improved. She's doing rejuvenation. I told her, forget about the acne scars, because if someone is having a problem, he doesn't see except his problem. We have to deviate the attention to a much bigger picture. 5 years. 5 years later, and her skin is looking much better and much younger. The same here. She came with acne scars. After 3 months, the acne scars improved, but she continues the sessions, and the skin is improving, and she gets older and much younger. This is a patient of rosacea. For rosacea, we learned that pulsed dye laser or IPL is the solution. But sometimes, even if we are improving the epidermal barrier function, if we are stimulating the collagen, if we are improving the health of the skin, this can be under control. When we are using the FRAC3, stimulating the collagen and increasing the thickness of the dermis by stimulating new collagen formation, this is going to compress the small, tiny vessels, and then the rosacea is going to be under control. 4D, after 5 years. She's 5 years older now, but her skin is much healthier, much younger looking. This is the 4D. So can you see? After 5 years, her skin is looking much better than 5 years ago. So again, we did not only stop the process of aging, we reverted the signs of skin aging. And this is what we are able to do. Large pores. In order to improve large pores, we need to improve the epidermal barrier function, because if we do that, then we are going to improve the skin elasticity and the pores are going to shrink. We need to stimulate the collagen, because collagen loss is going to be associated with large pores. We need to tighten the skin, because skin laxity will enlarge the pores. So we need to target different layers of the skin, and when we do that in the right way, look what happens to the pores. This is after 2 years, almost 2 years. And we can see in general her skin. So this is what we are able to do when someone is having chickenpox scars like that. It's not enough to do fractional laser or to do microneedling. It's important to have a global approach, improve the barrier function, tighten the skin, stimulate the collagen everywhere besides the areas of scars as well. So this is what we are able to do. Look at the skin. It is not only the scars. So this is the 4D and how we are able to utilize this technique in order to improve the different layers of the skin whenever this is required. A new concept which we started to see at our clinics is prejuvenation. We started to see young ladies in the late 20s or early 30s where they don't have manifestation of skin aging, but they don't want to see it. They want to delay it. So we are able to perform procedures which are associated with no downtime, with no pain, not causing any harm, just to stimulate the restructuring of the skin, do something to improve the epidermal barrier function, do something to stimulate the collagen, tighten the skin if there is degree of skin laxity, and this is called prejuvenation. Instead of doing 3 sessions on monthly interval, we do 3 sessions every 3 months, 1 session every 3 months, and then once per year. This is called prejuvenation. We can delay the signs of skin aging by rejuvenation and by improving the structure of the skin. So this is something which we really feel that we found the fountain of youth. When we are able to have the right tools to restore the structure and the function of the skin, then we are able to keep the skin young for much longer time. Before I finish my presentation, I would like to give a hint about the ESLD. The ESLD is the European Society for Laser and Energy-Based Devices. This is the society I'm president for. It has many activities for the members, but one of the most important and most significant activity is a teaching course. Teaching course is done in one of the university hospitals in Europe every 6 months. I just came from Florence. We had one in the university a few days ago. And usually the teaching course is over 2 days. Usually we have 7 world-renowned speakers. We have 4 theoretical sessions and 3 hands-on sessions. And we deal with all the basics of the laser over those 2 days. This is one of the things which I really encourage my colleagues to attend at least once. The next one is going to be in Bucharest, Romania, in 13th and 14th of February. So, no need for the air, no. So what we have is someone who is having some photo damage. So ideally, I would do for her 4D. But she has pigmentation. Her main concern is pigmentation. For the sake of the demonstration, what I'm going to do today is the green toning. Green toning means that we are going to use the Q-switched laser with 2 passes. The first pass is 1064 in order to target the deeper pigmentation, and also it was found that Q-switched NdEgg with low intensity is able to stimulate the production of collagen type 1. So this is considered one of the ways of rejuvenation. And then we do the 532 with very low fluence with 0.2, 0.3, also generally in order to deal with dyschromia. And then on top of that, this is the green toning. On top of that, I'm going to target the areas of freckles with a bit higher fluence with the KTP in order to get rid of the pigmentation. So this is what we are going to do. Now, the first step is going to be the 1064. I'm not sure if we can see the screen or no. The screen, okay. The screen, as you can see, I'm using 8mm spot. 3 joule per centimeter square, and this is 5 hertz. 5 hertz means 5 pulses per second. So I have to be running a bit quicker, and this is going to cover the whole face. So the machine is calibrating. Once we see the aiming beam, then we are ready. And I'm going to start the treatment. Don't worry, it's not going to be painful. You will feel very mild heat or just like pinpricks, very superficial. Don't worry. We started the treatment. As we can see, it is very mild. I'm trying to cover everything. There might be some mild erythema, or sometimes the erythema is very minimal. So nothing, actually there is no endpoint. I just need to cover everything in a homogeneous fashion. This is 3 joule per centimeter square with the 1064 Q switched. As we can see, very mild setting. No pain, no downtime is expected. By the way, these settings are the same settings I'm using for hair bleaching. If someone is having very fine hair, which is not going to respond to the long pulse lasers, if we use long pulse lasers, then this is going to be associated sometimes with paradoxical hair growth. So in this case, it might be the best to just bleach the hair, and then the hair is going to fall off. So those are the same parameters I'm using in that indication. Also, another indication for those parameters is the trichostasis spinulosa, the black dots on the nose. Those are not blackheads. Many people are thinking that those are blackheads, and they think that facial cleansing is going to be taking care of the problem. No, this is trichostasis spinulosa, dormant hair follicles. So for this problem, I use also the same parameters I'm using now to get rid of it. Usually, very nice result. In 2 or 3 minutes, we get rid of the problem, and then it's going to come back within maybe 6 months. We do it again. When it comes back. If it comes back within 6 months, we do it. If it doesn't, we don't. If it comes back in 4 months, we'll do it again. I'm almost done with the first layer of the 1064. And then I'm going to switch the machine to 532. And we have to go very low.
They can see the...
Yeah, just, okay. So this is... Yeah. So this is 0.3 joule per centimeter square with a 532, but we need the goggles. We need the specific goggles. Eyes and not the rod. The 532 needs a goggle. I worked with the 1064 without goggle, which is not correct, but with the 532, we have to have the goggles. I don't know. We have to make sure that it's covering 532. But I think also the cameraman will need one. Do we have two? Yes, this is 532, yeah. So we need something for the cameraman. دكتور هتقفل عينك. You'll close your eye. Okay. Okay. So 532 is going to be a little bit more spicy. And usually the pigments will react to it a little bit more. But it is very nice because we are covering 100% of the surface. So for dyschromia, which is generalized, this is going to improve. Almost done, just the forehead. Okay, so I did the green toning. We can see the erythema. There's difference between the color of the skin here and here. Diffuse erythema, which is totally okay. And now I'm going to use a bit more aggressive settings to target the pigmentation. So with the same wavelengths, because this is epidermal pigmentation. What she has is freckles. So with the freckles, this is epidermal pigmentation. So the only thing which will work is 532. So I need to go with a smaller spot size, like 3 millimeter, and I will need to go like I prefer to start with 1.2 or 1.3. So this is 1.3. I had to go down to 4 to increase the spot size to 4 in order to lower the fluence. So I'm using 3.9 spot, and this is taking me to 1.3. I cannot go below that. So 1.3 is going to be what I'm going to be using for the freckles. And I expect to see some immediate white color, and this is an endpoint which I need to see to make sure that we are using the right parameters. So I'm going now to target the different lesions with those parameters. And of course here I don't need to be having high frequency. So 1 hertz is going to be enough. I don't want to be too fast. So it is 1 hertz, and the machine is calibrating. Now we are ready. So I'm going to target the different, I don't know if the camera is showing the immediate whitening, but this is what we expect on the lesions, this immediate whitening. This is a very good endpoint, which we are looking for to make sure that we are using the right energy. The darker the pigment, the less fluence we need. If we have more faint pigment, we are going to see that the whitening is going to be less, and in this case we might need to pump up the fluence a little bit more. Another option in this case is to use the Herbemiag, to do peeling with the Herbemiag on these specific lesions so that we are able to get rid of it. But we have to tell the patient that this is considered an ablative procedure, where there will be a superficial peeling of the skin and it's going to undergo healing with some erythema for some time. For this kind of treatment, we expect that the lesions are becoming a bit darker. Very small superficial scab is going to form, and then it's going to fall off within few days, and then it should be looking lighter afterwards. Can you see the immediate whitening? This is a very good endpoint, and this is what actually we expect. I think that's it. This whitening is going to go away quickly, and then the lesion, those lesions are going to be looking a bit darker. So we have to tell the patient that from the beginning so that they know what to expect. As a post-skincare, we need to use a moisturizer, a moisturizing cream. Of course, for the coming days, we need her to avoid the sun as much as possible, and using the moisturizers all the time so that those scabs are going to fall off quickly.
We can use a moisturizer.
Yeah. We are going to apply, but not Vaseline. Yeah, something water-based. Yeah, acid hyaluronic. Excellent, very good. How do you feel?
It's okay.
Everything is okay. Okay. Was it painful?
Not really.
Not really. Which was the most painful step? The first step, or the second step, or the third step?
The second step.
The second step, which was the KTP with 0.3 joules, because it is covering the whole skin. So this is, she said that this was the most painful or irritating. And the last step, which is targeting on the lesion, was it okay?
Yes.
Yeah, it was okay. Perfect. Okay. So thank you very much. And please try to avoid the sun in the coming few days. Not very strictly, but as much as you can. And use moisturizer all the time so that the scab falls off. Don't pick the scabs. Let it fall off by itself. And within 3-4 weeks, we expect to see some results of what we did today, the final result, in about 4 weeks.
Okay.
Okay? Any questions?
No, it's okay.
Okay.